So thank you very much. Hello, everyone. So my name is Nati. I'm the Global Community Manager for IAPHL. So I will do a quick introduction of IAPHL for people that might not know us. So IAPHL is a community of practice that gather public health logisticians, professionals, and also people that are passionate about this field. And as I just said, we are a community of practice where professionals meet to share experiences, innovation, and we are trying to create activities like this one, webinars, when we can get all these great people together. So yes, I'm really happy for this webinar starting, and I'm sure that you will learn a lot of good things. So I will introduce one of our speakers. I will not introduce Claire for now. She will start later. So we have Colette on the room. Hello, Colette. Hello. So Colette is the Managing Director for JC Auditors. So you can have the floor and present you quickly before I give.
Thanks, Natty. I think Oliver will be presenting now. Sorry about that.
Okay.
Oliver is the Managing Director of JC Auditors, and he will share his screen now, and
Okay.
then we'll hand over to Colette.
Okay, no problem. So we'll start by Oliver then.
Great. Thank you so much, Natty, and thank you to the IAPHL and SAPICS for allowing us just a couple of minutes to chat around what's a very topical aspect, especially now in South Africa, with the recent regulatory requirement. I've got 10 minutes, so I'll be running through my slides fairly quickly, but just to give you an overview of exactly what the global QMS for medical devices entails, and also chat to you, about the process. I need to just move my screen a bit. Okay. So many of you will know that ISO 13485 is an international standard that's applicable specifically for the medical device sector, and that's the in vitro devices as well. It focuses both on how does one, as a medical device a company, meet both your customer requirements and also ensure that the regulators are happy as well. Now, although it is a regulatory requirement or pending regulatory requirement here in South Africa, I believe, and certainly many of us in the industry believe, that the standard helps one to improve credibility of your business. It enables one to build on a platform that allows for service delivery and continual improvement. So it's about structuring one's medical device business, and that could apply to medical device manufacturers, distributors, and wholesalers, and it applies to companies that also service medical devices as well. There are quite a few benefits that are being reported, increase in profitability, reduction in waste. The standard also allows for better control of your service providers. And what's really important for ISO standards is that it allows a really structured mechanism for identifying and mitigating risks. And we know, especially with the need to ensure patient care is not compromised, the need to ensure that device efficacy and performance is maintained, the standard allows for all the protocols needed to deliver on those outcomes. As I've mentioned, the local regulator, SAPRA, have indicated that any company who wishes to obtain a medical device license, and that's applicable to manufacturers, distributors, and wholesalers, will need to achieve ISO certification by the 1st of April 2025. Effectively, anyone applying for the license 3 months prior will need to show evidence of certification. The public comments have closed a few days ago as well. So how does one apply? So you need to obviously fill out a form just to confirm exactly what the scope of one's business is, to confirm the facility, the number of employees, and the processes involved. And then we would need to look at that application and determine the risk level based on which specific category you fall under, your footprint, and how high risk are your processes in terms of the ultimate delivery to patient care and positive patient outcomes. One would need to undergo an audit that would look at to what extent your policies, processes, and systems in place meet the requirement of the standard. So typically there is a stage 1 audit, and stage 1 looks at is there provisions in terms of processes, facility, technology, and checks and balances to ensure that your medical device processes are well managed. The stage 2 audit is really where everything gets looked at in a fair amount of detail. And here we do traceability on all, or not all, but on a sample of medical device transactions. And it's important to identify what are your critical control points. How do you manage product recall, for example? How do you handle quarantine product? How do you handle non-conforming product? How do you validate your processes, etc.? But many of you would be familiar with the requirements already. And I think in 10 minutes, it'll be impossible for me to even go into it. But I think if you need more info, please give me a shout, and we'll gladly send you more information in that regard. The certification is on a 3-year cycle. So we have an initial audit and then 2 surveillance audits, which essentially would validate that your processes are complying with the requirement of the international standard. So that's kind of in a nutshell what the medical device certification entails. If you need any further information around how you go about it, you're welcome to give us a call, and one of our, or drop us an email, and one of our team will gladly chat to you around that. Thanks very much, Natty and Claire. Appreciate the time.
Thanks, Oliver.
Thank you. Thank you very much, Oliver. Okay, so we'll give the floor to Colette Marais. She's the medical device manager at Johnson & Johnson Global Public Health. Colette, you have the floor.
Thank you, Natty, and good afternoon, everyone. Can you all see my screen and hear me clearly? Perfect.
Yes, we can. Thank you.
Thank you. So my name is Colette. I work for Johnson & Johnson.
Sorry, please do you mind muting your mic? Sorry. Natty, are you able to mute?
Yeah, I'm trying
There
to
we go.
mute.
Thank you.
Yeah.
Thank you very much.
You can go ahead.
Right. IAPHL for this opportunity. I work for Johnson & Johnson in the medical device field on the global equity part. So we are working in a lot of the low middle income countries, and we supply medical devices to certain countries. So to start with, our team, our global surgery team in Johnson & Johnson, Our initiatives are made possible by collaborating with a network of implementing partners. And all the surgery shown in the is performed by the surgical community in Malawi. So I'm going to give you a bit of information what we do, and then I'm going to give you information on a certain project that we currently run in Malawi. If you've got any questions, if it's okay, please keep it at the end, and then I can answer all the questions. So our work that we do, our mission is to make relevant innovations that saves lives, cure patients, and prevent disease. We want to make medicine as well as medical devices available, affordable, and accessible to the world's most vulnerable and undeserved populations. So our team in Johnson & Johnson, our strategy is to bring and procedures in place to improve healthcare, in this instance, in Malawi. Our global surgery team started a project, a long bone fracture project in the year 2022. We donate medical device, orthopedic medical devices, which is plates and screws. We donate that to Malawi. And through this product donation, we get patients to return back to life in a faster time. As you can see on the bottom, we do join forces with a lot of collaborations because we as Johnson & Johnson cannot make this on our own. This is just to give you the broad spectrum of how important trauma care is actually, or should actually be prioritized. So because trauma, particularly from road traffic accidents, right? So everyone that's in a road traffic accident, that actually kills more people than HIV, malaria, and TB combined. And that is why the burden is so big in musculoskeletal trauma. So this is why we focused for the first time on medical devices, because there's a lot of pharmaceutical interventions as well as initiatives in Africa. But because medical devices is number one so expensive, no one is doing this. But I don't think globally anyone realized how important surgery for people in less privileged countries, that is a very, very big priority. So why Malawi? Why did we go to Malawi? It's relatively a small country. Unfortunately, it is the number one country in Africa with the most traffic accidents and deaths in Africa. And through these road traffic accidents, there's obviously a lot of complications, which the biggest one is the amputations, because they do not have the correct equipment or medical devices to treat these patients. So what does it mean to have the access of these medical devices to a hospital? When we started, we improved the standard care, which was actually skin and skeletal traction, to actually provide equipment to the surgeons to do surgery. So in simple terms, where a patient was lying for 3 months in bed for a fracture, his broken bone to heal, he can now walk out of hospital within 2 weeks. We only concentrate on the long bones. So we supply Malawi with certain plates and certain screws, as well as the external fixation. Now, if you think about in the pharmaceutical world and on the medical device world, supply chain is very, very different. So just to give you a very broad, high-level overview of how different medical device supply chain could be. So say, for instance, you want to have just one COVID vaccine. You work with one SKU. You need one shipment of 1 million or how many vaccines, obviously in cold chain. And then you need cold chain facilities at the healthcare you're going to deliver it to. And then when you start administrating it, you will probably need less than 10 minutes to administrate the vaccine. So this is very, very high level. on what you will need for one COVID vaccine, right? If you take one orthopedic surgery, you will need about 10 to 20 SKUs per surgery. You will need multiple shipments quarterly to replenish the stock. You need an inventory management system, which is probably a software system, and most of the low middle income countries do not have such a system. They use manual counting. And then you need quarterly shipments. Our quarterly shipments is about anything between 500 to 600 SKUs with more than 6,000 items. And you need obviously dedication from the hospital and the nurses to run this inventory management system. And then on the side, you will need a ready theater or an operating room. You will need x-rays. You'll need serialization equipment, surgeons, post-operative care, and so forth. So it makes sense that there's a lot of companies that do not want to invest on a medical device supply chain because it's more complicated. But if you do have the right if you do have the right equipment and the right programs, it's really so much easier. So I'm going to take you through our long bone fracture program in Malawi. Our objective in this program is to simplify orthopedic medical device inventory management through automatic systems and expanding supply chain education and training in Malawi. What we want to accomplish here, that not only doing the donation of the products, but also to teach all the hospitals how they can work with the automatic supply chain inventory. So it's not only limited to orthopedic products, it can be anything, but we are training them how to use such a system. Our vision for this project was to deliver the instrumentations and products, which we did in 2022. We focus on the replenishment, we focus on the ordering, and then we focus on a standardized procedure, how we can replenish quarterly. We delivered inventory in 2022 to treat about 3,000 patients surgically. Now, in 2023, we just reached our target and delivered inventory for over 3,500 patients. So just to give you a very broad overview of how long it actually takes us to get the inventory to Malawi. We do order from the USA, from America, and there's only tax reasons for that. Because if you think about the world map, it would be very easier to get the stock from Europe, but due to tax reasons, we need to get it from the USA. So we will submit an order from the USA. We will ship it to our donation partner. So Johnson & Johnson do not ship it directly. We use a donation partner. Then when the partner is actually creating this order, the inventory will sit with the partner anything between 6 to 8 weeks. Then it will be sent to Malawi, and then custom clearance will take about 2 weeks with delivery on the ground. So on a big spectrum, it takes about 3 months for our stuff or our products to be delivered from the USA to Malawi. As everyone knows on this call, you would probably need hardware to set up such a system. So you will need a scanner, a desktop or a laptop. And we've made some inventory control books. I will show you in a minute how that works. And then you need the software set up. Luckily, we in Johnson & Johnson do have such a system, software, but I know about various companies that got the same type of system where you just scan a barcode in and the stock has been counted for you. So this is a process flow that we are currently doing in Malawi. So the surgeon will do the surgery in theater or in the operating room. The nurse in the operating room, she will use this book to basically just tick off what the surgeon is using on SKU level, right? Then that form she will tear off and she will give that form to the sterilization department in the hospital. The sterilization department, they will wash the instruments. Let's say we call it a toolbox, or the box where all the products is going in. They will wash that. And then the sterilization champion will go and pick the stock from the cabinet according to what the nurse wrote down in the operating theater. When the champion picks the stock, the champion will just scan out the stock, and then they will just put it back in the toolboxes. It gets sterilized again, and the surgeon will use the stuff again. So this is a very simplified breakdown of what we do. The surgery happens. They manually just tick off what they use. They pick those products in their cabinet. They scan the stock out. And then obviously when they scan the stock out, it is locked on a system. Then they will open the little baggies. They will refill the toolboxes. And then I will see it on my system and I will submit an order to Johnson & Johnson. So when we started off with this project, this is for you, for those that's actually in the hospital, busy with medical devices, this is a good tip just for future. We decided for storing the place inventory initially did not work because, as you can see, we couldn't differentiate between the screws, the sizes. So there's about screw sizes from a 10 to a 60. So we couldn't see that. So this is a very bad decision to have storage boxes like this. So we changed to something like this, where you can actually put all the screws in a little small divider, and you literally can go through and sort, and it's easier to pick your stock. So it's very important that not only your software is in place, but your storing mechanism is also better, because if you do pick the stock, you don't want to take forever to actually get the stock from your cabinets. So the software program is fortunately a Johnson & Johnson program. I'm just going to show you 2 slides of what we can see on our program. So this is every hospital in Malawi has got this program, and they've got their login details. So if you just open a hospital page, say for instance, Hospital A will open, and then you can see the product usage. You can actually choose what product usage you want to see from what date to what date, and it will always give you the inventory today. So the inventory on hand, or the inventory today, is very important, because that is obviously the inventory that is left in the cabinet in the hospital. You can also set a minimum bar to a SKU to say, if this SKU gets below 10, I should be notified. And then you can do that with all your fast movers or slow movers. So you can set and custom every account that you want according to what you want to see. The second page is just one page I want to show to you, but you can do an inventory overview. You can do a specific drawer details. And most important for me sometimes, to see the fast movers and the slow movers. I think in medical devices, that will be very important, because medical devices are so expensive. You do not want to overstock. And you also do not want to understock, because it takes about 3 months to get the stock there, right? So it's very important when I do the ordering, I will look at the product usage. I will divide it in certain months and do a safety stock, and then I will order. And sometimes for the fast movers, I will order a bit more. So there's a lot of capabilities you can see on such a software program. But as mentioned previously, it is not only Johnson & Johnson that do have such a system. There's a lot of other companies where you can use a system like that. So this is basically a very high level. What we do, I can take you the last time through the flow, is that the inventory control books we make ourselves. So we just print the books, and then the software we use from Johnson & Johnson. The stock is also coming from J&J. And then the hospital and all the sterilization people, they receive training from us to log all the inventory themselves and scan everything in and out, and then to refill the sets. So if there's any other questions, I would be more than happy to answer that. Thank you so much.
Thanks, Colette. Sure, that was quite an amazing process. Thank you for sharing with us.
Thank you for sharing
And
with us.
congratulations on your excellent work.
On your excellent work.
Thank you, Claire.
Any questions from anyone
Any questions from anyone?
or comments?
Just from my side, have you do you supply directly to each hospital, or do you have a hub in Malawi where you keep the stock and then have a shorter lead time from there towards the different hospital? I assume it's different hospitals. You didn't speak about the volume of hospitals that you support.
Yeah.
So
Yeah.
I don't know if there's.
So we did that in the beginning. I think, Claire, can you maybe mute your... I hear myself, there's an echo. Oh, that's fine. That doesn't matter. Sorry, Bernard, to answer your question. So we're working with 7 hospitals. Good question. We started off with a warehouse, but we want to make it sustainable for the hospitals themselves. So Johnson & Johnson is moving out. They can still run their own inventory. So we closed down the hub. So what we do when we place the order in the USA, we give them 7 numbers and they pack the stock according to 7 hospitals. So when the stock arrives in Malawi, we've got 7 boxes with 7 hospitals' names on. And those boxes just get dropped at each hospital and they've got their own inventory. So we do not need a hub because the boxes come into customs from the US with a hospital name on it. So it will be distributed from customs directly to the certain hospital. Does that answer your question?
Yes, thank you. Thanks.
I'm nervous to unmute because of the
No,
echoing.
that's...
But any other
No,
questions?
it's now away. Maybe it was my one.
No problem. Any other comments or questions for Colette?
Yes,
Can't see
Trevor.
any.
Hey, Trevor Lambiot. I wanted to just ask what's next. I mean, so first of all, thank you. Very impressive. Yeah, where to next? What's on your the plan in terms of the strategy going forward?
Are you only talking about Malawi?
No, I mean, if it's bigger, then what's the bigger plan? But yes, maybe if you could answer it in 2 parts. Maybe what in terms of Malawi, and what's your plan in terms of potentially rolling this out to other geographies?
100%. So Trevor, at this stage, we would love to go to more geographies. So that is obviously one of our points that we really want to look into to see what country we can go next. And then obviously in Malawi, we want to make it for them, as previously mentioned, self-sustainable. So if Johnson & Johnson go to another geography, that they can survive on their own. For instance, they can still use the system because our Johnson & Johnson system, it's an external system. They can still use that. We don't have to help them with that because they're already trained. So they can go on their own. And that's our project strategy also, to basically not be reliant on Johnson & Johnson, but they can do the inventory themselves. So at the end, I think there were a lot of, last time when we were in Malawi, there was a diabetic summit or something, and they also wanted to know, would it be better if they give them a software inventory system to trace all the diabetic insulin and medicine? But the nurses was actually very excited because now it's familiar to them. So it's also, we want to create a familiarity about automatic system. Like, you don't have to do it manually, right? So yes, we want to go to more geographies. We want to do more, but we are now in this program for 1 year and 6 months, 8 months. So we will see how it goes. But yes, sorry, Trevor, I cannot 100% answer your question, but I hope that will do.
Yeah, no, that's perfect. Thank you. Yeah, I just want to kind of get a sense of your aspirations, and bringing in the possibility, let's say, of more geographies, or the hope of more geographies.
Yep.
I wanted to ask about the challenge. I think we see in, let's call it a proliferation of the systems that do the same thing, but they tend to, unfortunately, in this industry, seem to be almost like vertically scoped based on whoever's system it is, or whoever's paying for it, candidly. And like, how are you looking to address particularly the interoperability with other inventory management solutions?
Exactly. So unfortunately, the Johnson & Johnson system only read the Johnson & Johnson barcodes, right? So that is obviously, unfortunately, a problem. So if the hospital use J&J, they can use the J&J system, but there must be some ways that if a hospital is using another competitor or another company, there must be integration in the systems, right? So I think that will definitely be something we need to concentrate in the future, how we can integrate some systems, or can we maybe design a generic system that not only Johnson & Johnson barcodes, but all medical device barcodes is on this system. So that's definitely something we could look into the future of creating a generic system.
Yeah, or just use whatever the country's already using, right? And then
exactly.
And there are already, I'm sure you're aware, many standards, particularly in public healthcare, for interoperability between systems. So yeah, and I don't imagine for you the system is the end, right? That's just the means to the end.
Exactly.
Okay. No, perfect. Thank you. Very interesting again.
Right.
Thanks, Trevor. Any other questions? Thanks, Colette. I hope you can see the nice compliments in the chat, and I do concur with that.
Thank you to everyone, and very much, Claire and Natia. I do appreciate.
Great. I just want to take 1 minute of remind those on the call about the SAPICS conference, the annual conference that's taking place in June 2024 in Cape Town, in which you can participate. And the first one is the call for speakers. So if you feel like you have a great story to tell, told, hint, hint, wink, wink to you, Colette. We ask that you answer the call for speakers, and it's a great way to participate, to share your stories, share your successes. We also, our early bird registration will end at the end of March. So it's a good time to get the attendance and perhaps an exhibition stand or sponsorship into your budget. And I can help you with that, as well as the Up Avon team. So please reach out to us, have a look at our website, and we look forward to continuing these types of discussions at the SAPICS conference. But we've got lots of things lined up for 2024, so keep looking out on our website and renew your membership, and we look forward to your further engagement. Thank you to the IAPHL for their partnership and just a reminder that membership of this amazing organization, it has a very wide reach, and it's in many, many countries, and they do great work. And if you are in the medical or pharmaceutical or healthcare space, this is an association that you need to join, and it's free. I did put the link earlier, but I will put it in my thank you email. And we will share the slides, share the recording, and give you some call to action links so that you can carry on engaging with us. Great. Thank you, everybody. We finished nice and early, so you can go and pour yourself a drink or have a cup of tea, or don't do your emails, because this is bonus time.
This is bonus time.
Thank you
Thank you,
very
everyone.
much.
Thank you very much.
Thank you.
Bye.
Bye.
Bye.